Hey mama, I polled my 415,000 followers and asked them, what type of birth class do you want? And they told me we want something simple that we can listen to on the go, whether you're nesting, you're walking, or just trying to rest. So I created the Calm Labor Birth Pod. It is my audio-only birth class designed for real life. So if you're pregnant, you're overwhelmed by all the what ifs, you don't need to Google. You just need calm, evidence-based guidance from a labor nurse. You can listen on the go. It's $97, or you can start today for just $33. Go to labornursemama.com/guide or hit the link in the show notes to grab it. Hey mama, welcome to Pregnancy Unpacked. I'm Trish, a labor nurse of 16 years, mom of 7, and your birth bestie. And I'm going to be walking you through not just baby bumps and fruit sizes, but the entire identity shift that pregnancy will be for you. Each episode drops every Wednesday, and we're going to unpack what's happening in your body, what to expect, what to do, what's normal, even when it feels extremely weird, and how to actually feel supported emotionally and physically. You're going to hear from me where I'm not going to sugarcoat it, but I'm going to be cheering you on along the way. You can follow along each Wednesday because pregnancy deserves more than outdated advice and Google anxiety. Welcome back to Pregnancy Unpacked. I'm Trish, your favorite labor nurse, right? I hope so. Mom of 7, and the mama who is just going to break down the truth about birth, even if it makes some providers uncomfortable, I guess. And just a word of warning, some of you guys who hang out with me, we went to the fair last night. We took Grace into the fair and we were up so late and it was so hot. And I have been busy bee today, and I am so exhausted. So bear with me. I know y'all love me, so bear with me. So we're going to be talking about 36 weeks pregnant. Girl, okay, you are almost full term. So yes, early term starts at 37 weeks, but trust me when I say you are at the stage where people are going to start saying, any day now, and better get that nursery ready and sleep now before the baby comes, and wow, you look like you're going to pop, and all sorts of noise. If that's you and you've hit 36 weeks, girl, this episode is about you, your body, your baby, and how to face these last weeks strong, because it gets hard. I've done it so many times, y'all. I have 6 babies that I've birthed. I have 7 children, but 6 that I've given birth to. All right, so let's talk about your baby first. Baby at 36 weeks, your baby is around 5.5 to 6 pounds and somewhere around 18.5 inches long, the size of a bunch of kale. But like way cuter, you know, if you're not a fan of kale, way cuter than kale. But what's really important to note is that if you go to the mall and you're looking at people, not everybody in the mall is the exact same length and weight, right? Not everybody is the same size, and your baby is not the same size. So I want to be really, really cautious when I talk about sizing, because I know a lot of providers use sizing to talk you into being induced or what have you. So just remember that humans in general come in different sizes and shapes, okay? So inside your baby's little body, they are storing fat for temperature control, which we talked about, brown fat. They are fine-tuning their brain and lung development, and they're dropping lower into your pelvis, which is called lightening. And we have some episodes on the signs of labor that you can listen to as well. They're still practicing sucking, swallowing, and breathing, getting ready to go from this, aquatic environment to breathing air when they're born. Now, if your baby has already dropped, you're probably feeling more pelvic pressure. We talked about last week, your vagina falling out, more peeing, again, just like first trimester, less heartburn, which is a bonus, yay, and more waddling. So if you weren't walking like a pregnant woman before, you probably are now, because it feels like that little baby is going to fall out of your vagina. Now, when we talk about your 36-week appointment, this one is really important because here's what usually happens. And now you are most likely going every week and you're still having your weight, your urine check, your BP, you're having your fundal height and baby's heart rate. They're checking position. Is baby's head down yet? At 36 weeks, most of you, your babies are head down, and we still have some time, but we do like to see the baby's head down by 36 weeks. Now, if you haven't yet, you should be having your Group B Strep test. And I'm not going to go into details. We have a blog post. We have an episode where I talk about Group B Strep test. And this is where they're going to be checking to see if you need antibiotics. Well, I say if you need, they're going to recommend that you need antibiotics, but you still have a choice. So do your due diligence. You might even begin to have questions from the provider about your birth plans and warning signs and when to call the provider and all of that. Now, if you're one of my students, I tell you to start talking about your birth plans early and often so that you can check and see how they respond to that. Some questions you can ask your provider is my baby head down? What happens if I go into labor before 37 weeks? What happens if I go into labor during the middle of the night? Where do I go? And what happens if I go into labor during the day? Where do I go to get to labor and delivery? And what's the process? And how do you want me to handle that? And all of those things. It's just better to know all of that ahead of time. Don't wait till the end. You can also talk to your provider about real labor versus false labor and get their take on it, even though I also educate you on that. But hear what they have to say. And just remember, asking questions, that is your right. You are not difficult. You are not that patient. And I say that with quotes. That makes you prepared. Okay, so a lot of moms during the 36 weeks start to freak out a little bit because they're like, okay, number one, I'm totally over being pregnant. But number two, I'm super scared about the pain of labor. Now, if you're still scared about labor, you need to get in my birth classes, period. End of story. You might be nervous, like your work situation, like how are they going to handle me being gone? Or are they going to be calling me 24/7? Or what's going to go on with my work? And you may feel just excited and totally freaked out all at the same time. And that is all totally normal. And during this week, your brain is starting to prep for baby as well, not just your body. So you're not just nesting, you're also mentally like nesting, like clearing space for this next level of who you're becoming. So if you find yourself in Target crying because they're out of your favorite nipple cream brand that your best friend told you to get, that is normal. That is totally normal. And you're fine. I promise you've got this. So at 36 weeks, like you really need to have all that preparation going, girl. You need to be intentional. You need to understand your rights. You need to learn how to advocate. You need to know what to do and when to do it. Like I said, even knowing like, where do I go if I go to the hospital during the middle of the night compared to during the day? Like those are all things you can get prepped for. And it's not about having this perfect birth plan. It's about knowing what you can and can't do, like knowing where to go and how to do it. Like knowledge will keep those fears and anxiety from going nuts. Trust me on that. So your week 36 checklist is to finalize your birth plan preferences. Remember, it's a map. It's a guide. Know your early labor game plan, when you go to the hospital, where you go, what's the process, what is your provider, like how do they want you contacting them, like who do you contact in the middle of the night, who do you contact during the day, all of those things. Your hospital bag needs to be packed and you need to have it ready to go. Like have it ready now, today. Confirm childcare if you have babies or pet care. Make sure you've got your work leave plans settled. And I want you right now to list out your postpartum support, whether it's meals or visitors. I want you to check with your insurance. What do they cover when it comes to mental health? Who do you call if you have breastfeeding issues or you want to see someone with breastfeeding? I'm going to link to a breastfeeding class that you can take while you're pregnant in the show notes that I recommend. Her name is Amber and she's amazing. She's got a great breastfeeding class that your insurance will cover. But get yourself prepared and ready, because trust me, when you're sitting there in postpartum and your booty is swollen and your boobs are hurting and you're crying, you're not going to feel like looking up who your insurance covers. So go ahead and have it all now. You are almost there. You're almost there. This is all part of your story. I hope you're journaling it. And I am so proud of you. You're so capable. You were never meant to do this alone. We're here with you. Keep walking with intention. Get prepared. And I'll be back next week with your 37-week check-in. Until then, rest when you can. Prep, girl. Trust yourself. You are the magic. You're amazing. And I'll see you again next Wednesday. Bye for now. I don't know if you know this, but I also mentor coaches and service providers on building their online presence. If you're someone who serves moms, parents, or families, whether you're a birth worker, parenting coach, a family photographer, or anyone else in this space, and you're struggling to turn your social media into actual clients, this is for you. You're posting helpful content, sharing valuable tips, maybe even growing, but you're just not making sales. Here's what I've learned. You don't need more followers. You don't need to post 5 times a day, and you definitely don't need to dance to trending audios. What you need is a strategic content system that actually converts. And that's exactly what I'm teaching in my Sold Out Offer Challenge. This isn't another content creation challenge. This is a 5-day deep dive into sales psychology and creating content that actually builds trust, which turns into paying clients. I've helped clients scale to consistent 5-figure months using this exact system. The Sold Out Offer Challenge starts on August 25th. You can join as a general attendee or upgrade to VIP for daily coaching and personalized audits. If you are ready to turn your content into an income machine, go to the link in the show notes or go to trishwarecoaching.com/SOO and let's make your content work as hard as you do.